That's great, thank you. There are many different types or subtypes of HPV, as I understand it, which lead to cervical cancer. Some are more serious than others when it comes to developing cervical cancer, aren't they?
Yeah, actually there are more than 150 types of HPV, but only 20 of them cause cervical cancer. Yeah, and of them, only there are 9 types that are actually responsible with more than 90% of the cervical cancer cases.
And what is the main cause then of cervical cancer?
It's actually totally HPV. It's caused by HPV, almost all of them, and HPV is the most common sexually transmitted disease.
Why is there some reluctance, some opposition in some countries to the vaccine?
But we need to know if there is significantly increased risk of adverse events comparing to non-vaccinated people. When we look at the vaccinated and non-vaccinated people, there is no increase in side effects. So it's totally safe actually.
What about the cost element? Is it an expensive?
In developing countries, we must reach them and educate them, and we must provide HPV vaccines to eradicate cervical cancer in those areas.
So how difficult a challenge do you think that is going to be to get this across the world so that more lives are saved?
Well, it may take some time, but I think we may achieve this at some point.
And what's the situation in your own country in terms of the use of the vaccine?
Yeah, we have vaccines, but it's not our national vaccination program. And after that, we will see very good evidence that we decrease our incidence of cervical cancer.
Because it would appear that Australia is going to be the first place.
Yeah, Australia is a very great example, and they were the pioneer of this vaccination program, and they reduced their cervical cancer incidence very dramatically in the last 10 years.
Okay, thank you.